Hey, it's week 7. Isn't that awesome? You are really close to wrapping up yet another course on your path towards your DMP. Congratulations. I'm really excited for you. We started this course looking over some of the basic principles of economics, how decisions are made by comparing marginal cost with marginal benefits. We moved into identifying some of the high healthcare costs and revenue shortfalls, including a peek into how we do our nursing staffing budgets for 24 by 7 units and even in some ambulatory areas. You moved on to your first big project, creating that strategy process framework as you prepare to propose a clinical need and provide the business case in that proposal for that. You analyze the connections between quality and patient safety and cost savings for organizations and for patients themselves and populations. You wrestled with building that business case for quality, acknowledging the high cost of regulations and accreditation in our current U.S. health system. You also had outstanding contributions on our week looking into ethics and the political forces that some of the choices our patients make are impacted by. Really, I know I sent in an email or note message to everybody that week, but outstanding contributions by everyone in this class. Great discussions. We move this week into really reframing your focus a little bit. We want to focus on the micro level, which is the patient, our individual point of care service areas. Look at service line benefits at the meso level for capacity and good patient care. And then really looking at the macro picture of our organizations and how the choices and financial decision making that is made today is going to impact our ability to provide care well into the future. Many of us work in organizations with over 100 years of service behind them. The UK hospital, Christ Hospital. There's an Indiana system that is totally eluding my mind. I apologize, Indiana. And Cincinnati Children's is another example of organizations that have been around for over 100 years. And we know that the choices and the investments and the care delivery that was done even 100 years ago has impacted our ability to be able to continue to provide those enhanced services today. So it is very exciting, and enjoy this little peek into the future. Don't get too weirded out. Chapter 16 gets a little woohoo, but it'll be fun to go back and review that at some point. I do want to acknowledge that a number of you are struggling with some of the pieces around data and what kind of data to include in your proposals. If you do spend just a few minutes going back to chapter 13, on page 319, there is a nice, just easy, some KPIs, key performance indicators there that could be as simple as looking at census. So are you looking to drive volumes? FTE, do you need additional resources? Overtime measures, harm index, so any of the patient safety initiatives, or even employee safety. So what are we doing to make our environments safer for employees, especially our nursing staff? So great job, good work. You're almost there as you finish out your work with your business proposal and financial plan. If you're still looking, there are a number of you I know who are ahead of the game and have already turned this in, but if you're still working to refine this, please, please, please just follow the rubric. You've done some outstanding work in each one of these categories along the way for the last 7 weeks as this course has built. You've established an aim. You have started to think about a solution for your specific problem. You've done that SWOT analysis a number of different ways. You've really given good voice to core values and of your organizations, and how to plug what you're proposing into the mission and vision of your organization. Spend some time though on financials, because that's really what we want the focus of your summary to be. Is there a future cost reduction involved? Is there revenue to be generated that is new? Many of you really did an outstanding job looking at your current margin in your organization. So are you in a position to be innovative and make some changes? Or are funds a little bit tighter and you have to really look at something that is definitely going to have that ROI, return on investment, or generate some new revenue that has not existed before? So spend a little bit of time there in your executive summary. I think that each one of you, I have looked at all of the work that you're proposing. The educators who are doing educational enhancements for our current employees, for simulated training, for the future nurses as you're working with undergrad students and how to transition them into professional careers. Outstanding work. Keep this up. This is exactly in line with building towards a very strong future for all of us in healthcare. The administrators among you who are looking to develop leaders and how we retain our staff complements, incredibly critical work at this juncture. And thank you so much for your thoughtful focus in this area. Outstanding. Again, just really, really strong work. The practitioners among you who are looking at population health initiatives to increase screening, whether it's skin cancer, whether it's nutrition, whether it's A1C, whether it's healthy weight and BMI, just outstanding work, as we really need to focus on our population health metrics. So it has been a total honor to kind of get to meet you a little bit via the computer. I wish it were more in person sometimes, but you're doing outstanding work, making great contributions. Keep it up, and hopefully our paths will cross again in the near future.